In January and February, when the vaccine started being used and cases came down, a lot of people felt that COVID is over. I think the cause for this is actually multifactorial, but I think the two main causes that one is that in January and February, when the vaccine started being used and cases came down, a lot of people felt that COVID is over and felt that they did not need to have COVID appropriate behavior. People stopped wearing masks, people started having parties, and there was a lot of get togethers and marriage functions because of the fact that all of them had been put on hold for a long time, for almost a year. Now, the virus was still around, and therefore, this gave an opportunity for the virus to spread itself rapidly. I also feel that at that point in time, unfortunately for us, the virus did mutate. A new strain was there in India, which was more infectious. It was able to spread more rapidly among people than what it was doing 6, 7 months ago. Currently, not only are we seeing record breaking numbers, we're seeing a huge strain in the healthcare system because of if you even say that only 15% of people will require hospital care, if you have 2 or 3 lakh people per day, then the number of people who require hospital care proportionally goes up. And also, if one person is admitted in a hospital, he's going to be there for 5, 7, 10 days. So your hospital bed gets blocked. And if you continue to have more and more people coming in, you will run out of hospital beds. Therefore, I think we have to have a multi-pronged attack. We have to keep increasing our hospital beds and resources for the increasing number of cases that we're seeing. But we also need to work aggressively on decreasing the number of cases. I can understand that we have a lot of, let's say, religious functions going on. This is the time when a lot of religious activities do happen in our country. And we also have the elections going on. But we must also understand that lives are also important. And therefore, we should have good COVID appropriate behavior. We can do this in a restricted manner so that the religious sentiment is also not hurt and other things can also happen. But aggressive COVID appropriate behavior is also maintained. We have to find a balance between the two things. If we don't have a balance, then we will have more and more cases coming up. Therefore, unless we're able to make sure that we are able to have the religious sentiments are also looked after, but at the same time, we make sure that it's done in a sort of a smaller manner or in a restricted manner so that it does not become a super spreading event. That is very, very important. Otherwise, the cases will continue to increase over the next few weeks and we will have a huge issue in terms of the healthcare system.